So today our topic is sternocleidomastoid muscle. Coming to sternocleidomastoid, first it is basically comes as an SAQ. Okay, so starting with, you have to mention the origin. Please spot the sternocleidomastoid muscle in the picture. Coming to the origin, it has got a sternal head and a clavicular head. So now I'll make it easier for you all. So the sternum head is going to come from the manubrium, and I will show it to you all here. So this is the sternal head and this is the clavicular head. Okay, coming to the insertion. Insertion is in the mastoid process and lateral half of the superior knuckle line. I'll mark that also. Now coming to the nerve supply, spinal accessory nerve and cervical nerves. Spinal accessory nerve is the 11th cranial nerve. Now coming to the action. So now, as you know, when one muscle contracts, that is one side of the sternocleidomastoid, when it contracts, it is going to turn the chin to the opposite side and tilt the head towards the shoulder of the same side. You can try and do it. Now, when both of the muscles contract, both of the sternocleidomastoid, on both the sides, when they contract, they draw the head forwards. For example, eating or lifting your head from the pillow. Then you flex your, it also helps in flexing the neck against resistance, and it helps in forced inspiration. Now, coming to the relations. We have the superficial relations and deep relation. In superficial relations, we have the lower end of the parotid gland, greater auricular nerve, anterior cutaneous nerve, external jugular vein, skin and superficial fascia. Now coming to the deep relations, I have this thing for you. Yeah, so now coming to the deep relations. So remember deep relations as PISSO. So P stands for the posterior belly of the digastric muscle, S stands for the spinal accessory nerve, another S stands for the splenius capitis, and O stands for the occipital artery. So that is how you are going to remember the deep relations, that is your mnemonic. Now coming to the clinical or the applied anatomy. Here the applied anatomy is quite interesting because you have torticollis or torticollis. So it is a deformity in which the neck is bent to one side and the chin is going to point to the other side. This is due to the result of spasm of muscles which are supplied by the spinal accessory nerve. So this you might have seen in Pushpa movie. Next is basically dry neck. So that is shortening of the muscle fibers due to the intravascular clotting of the veins within the muscles that occurs during difficult delivery of the baby. Okay, so this was it for the sternocleidomastoid. I hope everyone has understood. Kindly like, subscribe and share. Thank you.